In this video, we discuss the use of Dukoral during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Many vaccines against infections have broad immune-stimulating properties. The Bacillus Calmette-Guérin (BCG) vaccine was first FDA approved to treat early-stage bladder cancer in 1990. Some of the most promising cancer drugs under development are actually based on modified versions of vaccines. For instance, the versatile anti-cancer drug PVS-Ripo is based on the polio vaccine. One vaccine may be able to be repurposed against cancer right out of the box. Dukoral, an orally administered cholera vaccine, has shown enormous potential against cancer. Dukoral improves natural killer cell activity and reduces inflammation. Dukoral is different from other cholera vaccines in that it has two parts: cholera toxin subunit A, CTA, and cholera toxin subunit B, CTB, which is used as an adjuvant to improve the efficacy of the vaccine. CTB, unique to Dukoral, has shown the ability to activate toxin receptors called ganglioside receptors in the gut. This activation leads to improved immunosurveillance and increased antigen presentation. So Dukoral may have uniquely strong anti-cancer properties compared to other cholera vaccines. In an animal model of colorectal cancer, the cholera toxin decreased the number of tumors formed by 75%. AOMDSS shows the number of tumors produced in mice that have been injected with colorectal cancer cells. AOMDSSCT shows the number of tumors-produced mice who have been injected with colorectal cancer cells and exposed to cholera toxin. There have been no randomized clinical trials performed on the efficacy of the cholera vaccine in cancer, but retrospective studies have been very encouraging. A 2018 retrospective study examined the effects of post-diagnosis use of Dukoral in 175 Swedish colorectal cancer patients. When these patients were compared to matched controls, Dukoral use resulted in a 47% reduced risk of death from colorectal cancer. Another 2018 retrospective study examined the effects of post-diagnosis use of Dukoral in 841 Swedish prostate cancer patients. When these patients were compared to matched controls, Dukoral use resulted in a 43% reduced risk of death from prostate cancer. A 2021 retrospective study examined the effects of post-diagnosis use of Dukoral in 617 Swedish breast cancer patients. When these patients were compared to matched controls, Dukoral use resulted in a 47% reduced risk of death from breast cancer. These results were observed irrespective of tumor stage, age, or sex. The only cholera vaccine used in the studies was Dukoral. Cholera vaccines are available for use in 60 countries across the world, including Canada, where Dukoral is available without a prescription for the prevention of travelers' diarrhea. In the US, the only cholera vaccine that is FDA approved is Vaxchora. The two other cholera vaccines used worldwide are Sanchol and Uvicol. It has become extremely difficult to get any kind of cholera vaccine administered in the US. Canada will sell Dukoral over the counter to tourists for the purpose of preventing travelers' diarrhea. Dukoral has very minimal side effects and has been shown to be safe for people over the age of 2. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.